this is the most exciting thing that's happened since this period began. We can't get this economy going until we beat the virus. And we can't beat the virus without a lot more testing. Fortunately, late last week, we got a potential game changer when Abbott Laboratories launched a new molecular point-of-care test that can detect the coronavirus in as little as 5 minutes. This is a very big deal and a serendipitous moment for the great American enterprise that is Abbott, right when the company's longtime CEO, Miles White, is about to pass the torch to his successor. By the way, under White's leadership over the past 21-plus years, the stock's giving you a monster 788% return. So let's check in with Miles White. He's the bankable chairman and CEO of Abbott Labs, and Robert Ford, the current president and COO, who takes over the CEO job tomorrow. Gentlemen, congratulations and welcome to Mad Money.
Thank you, Jim. Good to be here.
All right, Miles, let me start with you because you are the dean of the entire industry. What kind of enterprise are you leaving Robert with?
Well, I'm leaving with one right now that's going 24/7, trying to provide tests to make a contribution to fighting coronavirus. I think it's a pretty strong organization, and I'm really proud of the management team and Robert for all they've been able to do and demonstrate. I leave a company that is just a tremendous collection of great managers that can sustain our business and hopefully do something to help fight this virus.
Robert, for the first time in a long time, and I wasn't teary-eyed, but I was so grateful because of everybody's lives being disrupted. When I heard you had this machine, when I heard you could do 5 minutes, I realized we're going to win this war. What we were missing was the opportunity to be able to beat this on the spot. Tell us how it could possibly work this fast, Robert.
Well, it's great to be here, Jim. Also, let me start off by just thanking the Abbott scientists, the manufacturing supply chain teams. They've been working 24/7 to get this done, and a lot of partnership with the FDA to be able to get this done in record time. But the ID Now system, which is our rapid point-of-care molecular test, can do the test in as little as 5 minutes, and the innovation is incredible. It uses molecular technology to be able to identify a very unique kind of virus genome through an amplification process. And it does it, amplifying it over 1 billion times in this little box to be able to find that virus. And yet it's still very simple to use. You take a swab, a nasal swab, you put that swab into a cartridge that's got reagents and chemicals, you close the lid, you follow the instructions on the test screen, on the touch screen, and you get a result in as fast as 5 minutes.
So if I'm at a hospital and I am worried about my doctors, which is the frontline soldiers in this war, I am able to determine whether they are sick on the spot.
Absolutely. And that's been our focus, actually, as we've had conversations with the administration, we've had conversations with the task force, with the FDA. We've had a lot of conversations with governors from different states over the weekend to be able to look at how we're going to allocate this test, to be able to test as many people as we can. The first priority as we roll out is our frontline workers, the ER doc, the ICU nurse, the police officers, frontline workers that are taking care of us. You know, we don't do PPE, but we do tests. And we want to make sure that their tests, these people are safe so that they can take care of us.
All right, so, Miles, I have to believe when it comes to Abbott, Abbott never stops at one thing. I have to believe that at 50,000 today, maybe it's going to be maybe 100,000 in 2 weeks or more than that, or a new kind of test, maybe even one we can use at home. Don't have to go to a car line. Don't have to have someone stick up our nose. We look and we decide we go back to work. Is that possible, sir?
It is possible. And, you know, I have to say, while we're very pleased with the performance that we've been able to deliver here, we've launched 2 tests in the last couple of weeks. There's still more, and there's a need for more. We have a collection of technologies and formats. We've got multiple R&D teams at work. There are more tests coming. There are serology tests, antibody tests. We're looking at automated versions of that and what we call a lateral flow version that's more like a pregnancy test. It's a test that doesn't require instrumentation. All of those are a matter of weeks to a couple of months away. And those teams are working around the clock, just like the ones who brought ID Now to us worked, and the ones who brought the automated test on the M2000. So There are more tests coming. They're also putting a lot of effort in the organization into capacity expansion because while 50,000 a day sounds like a lot, it's not enough, and we know that. And for a while, we'll be allocating and prioritizing to high-need areas, as Robert's indicated. We know that fighting this virus and being able to go back to a world that's more normal is going to require a lot of testing in the right places with rapid turnaround. And fortunately, we have multiple formats to do that with. So, yes, that's all possible.
Robert, you just heard Miles say maybe get back to the way it was. When I think about the testing, to me, that is what's key to get people back to work. I have to believe that the president knows what you're doing, that Dr. Fauci knows what you're doing, that the FDA is so on the case to let this happen, and that this is the breakthrough we've been looking for. We had Thermo. I love Thermo. I think Roche is great. But those turnarounds are not fast enough for the American people. This is correct.
Well, those are great companies also, and I think we've got to look at this comprehensively. Without a doubt, the point of care is a game changer. To be able to do it in 5 minutes, we've been in conversations, as I said, with the administration, with the task force, to be able to kind of deploy this in a way that allows us to test as many people as we can. But as Miles said, 50,000 per day is not enough. So we have to rely also on the lab instruments that are in the labs, in the hospitals, to be able to kind of support all testing needs. And as Miles said, we had an approval 10 days ago for our lab instrument. That's gone very well. We've shipped over 1 million tests by the end of this week, and we're going to double that during the month of April, too. So we have to test, and Abbott is definitely looking, as Miles said, across different form factors, different types of testing and environments so that we can get there.
Okay, so Robert, I know when I speak to Len Schleifer at Regeneron, when I speak to the people at Roche, when I speak to the people at literally everybody who's involved in trying to come up with a vaccine, what I hear about is you got to have serology. I know that Miles mentioned that. Robert, explain to people how if we knew the blood, if we had the blood of people who have beaten this, what this could mean to be able to get our country back.
I think it's super important. That's why we kicked off 4 teams. The serology team is the 3rd team. They've got the light shining on them right now. And it is very important for you to be able to detect. There are 2 antibodies that are important to detect. The IgM antibody, which is more of an acute antibody. It kind of pops up and then comes down after about 4 days. And then the IgG antibody, which could last for about a year. So if you know that for some reason you were infected, you got over it, you now know that you've had the antibodies, and that is going to be important as we really look to reopen the country.
All right, so Miles, you've been an unbelievable steward of a great American company. Did you ever for a minute think that this thing could beat us?
You know, I think we're all properly challenged, meaning we're taking it seriously. We're afraid of it, but at the same time, we're afraid of the damage it can do. Do I think it can beat us? No, I don't think it can beat us. I think the frustrating thing is the time it takes for us to come back at it. I'm excited about the announcement J&J made today, and I hope to God they can get there fast, and that any other companies with vaccines can too, because I think we're going to need vaccines, we're going to need medicines, we're going to need a lot of things for a long time in order to beat it. Do I think our scientists will beat it? We'll beat it. And someday there will be another one that we'll have to beat. So we'll learn from this one, and we'll be ready if it ever happens again.
Okay, Robert, last question. When I look at Abbott and I hear that maybe there can be, like a pregnancy test that Miles said, what I am envisioning is that there could be something, maybe even by the summer, where we could get tested, all of us. If we decide, you know what, I don't feel well, that we could get tested, maybe even over the counter by prescription. Because if we don't feel well, we stay at home. And if we do feel well, we go back to work and we get the country moving again. Is that a possible vision?
I think that's definitely a possible vision. You know, maybe the summer might be very ambitious, but that's how we're working at it. We believe that we can scale up these tests, and I actually believe that we're going to have this COVID test available not just beyond this the summer, but maybe into the fall, so that, as you said, if I feel a little that I need to get a test, I can get a test.
So Miles, tell me, how's the administration handling this?
Jim, I can only comment on that from the perspective of the testing. And I would tell you that the administration has been incredibly supportive. They've acted with urgency and professionalism. I'm particularly impressed with, frankly, all the support that's come from the White House and from the FDA. The FDA has turned cartwheels here. I've never seen anything like it in my 35 years at Abbott. Since 1985, when the first HIV blood screening test was done, Dr. Fauci knows that. What the FDA has done here with the review and the approval of tests has been phenomenal and incredibly supportive, and so is the administration. So I have nothing but positive things to say about it. There's been no obstacle here. All the companies in our industry have been working 24/7 to create these tests, and we've had all the support necessary.
Thank you so much, gentlemen. Miles White, outgoing CEO, Robert Ford, ingoing CEO, Abbott Labs. Great to see you, and best of luck.
Don't miss a second of Mad Money. Follow @Jim Cramer on Twitter. Have a question? Tweet Cramer. #MadTweets. Send Jim an email to madmoney@cnbc.com or give us a call at 1-800-743-CNBC. Miss something? Head to madmoney.cnbc.com.